Guys, and welcome to a tutorial on the arterial blood supply of the head and neck. You'd remember that the main arteries of your head and neck are going to be the subclavian arteries as well as your common carotid arteries. And just a bit of thoracic anatomy. Remember the arc of the aorta. You're going to have an innominate artery with a brachiocephalic trunk, which behind your sternoclavicular joint will divide into the right common carotid and the right subclavian artery. And also from the very same arc of the aorta, you're also going to then have the left common carotid and the left subclavian arteries. And your subclavian arteries were going to be the artery proper of the upper limbs. And for the right one, like I just mentioned, it originates from your innominate artery behind your right sternoclavicular joint, and you only have a cervical part. Unlike this left subclavian artery, which is going to have a thoracic part as well as your cervical part, right? And on each side, these subclavian arteries, they're going to arc laterally across the anterior surface of your cervical pleura that is associated with the apex of the lung, and they go onto the first rib. And if you remember the first rib, there was going to be a scalene tubercle, and just anterior to that scalene tubercle, you're going to have a groove for the subclavian vein. Then you then have a groove that is posterior for the subclavian arteries. So these arteries, when they arc onto the cervical pleura, they go onto the first rib behind this scalene tubercle, and they're going to end at the outer border of the first rib by becoming your axillary arteries going to the upper limb. And the scalene anterior muscle is then going to divide your subclavian artery into three parts. And the first part is the one that is going to be from the origin. For the left, it's going to be starting on the arc of the aorta. For the right, it starts just behind your right sternoclavicular joint. So this first part is from origin to the medial border of the scalene anterior muscle. Then the second part is the one that is going to be behind the scalene anterior muscle. And the third part is the one that is going to extend from the lateral border of your scalene anterior muscle to the outer border of the first rib, where it changes name to become your axillary artery. So the first part is going to give you 3 branches if you're on the right side. Then if you're on the left side, you're going to expect 4 branches. And those branches are going to be, there is your vertebral artery, then there is the thyrocervical trunk, which is quite short, and we immediately divide into 3 smaller branches. That is going to be the inferior thyroid, the transverse cervical, and the suprascapular artery. Then we're also going to see the internal thoracic artery, formerly known as your internal mammary artery. And on the left side only, the first part will give us the costocervical trunk, which for the right side is going to be a branch of the second part, right? Then for the third part, it's going to give us occasionally the dorsoscapular artery, which is not always going to be present. And when present, the dorsoscapular artery would then replace the deep branch of the transverse cervical artery, which is a branch of the thyrocervical trunk, right? Looking a bit into the branches, the vertebral artery will be the first and the largest branch of your subclavian artery from the first part, and it's going to have 4 parts. So it's going to be the first part, which is the cervical part, which lies in the scalenovertebral triangle, and this is going to extend from the origin of your vertebral artery to the foramen transversarium of C6. Remember, it will only traverse the foramen transversarium of C6 to C1. Then the second part is the one that is the vertebral part, which lies in your foramen transversarium from C6 all the way to C1. And the third part is the suboccipital part, which is going to lie within your suboccipital triangle. Then the fourth part is the one that is then going to lie within the cranial. That's going to be the cranial part. And if you look at the vertebral artery, it's going to give you spinal branches from its second part, as it lies within the foramen transversaria of your upper 6 cervical vertebra. Then it's also going to give you muscular branches in the first part and the third part. And for the third part, it will give you muscular branches that are going to the muscles within the suboccipital triangle. And for the first part, it gives you branches that are going to the prevertebral muscles. Right. Then it's going to give you an artery known as the posterior inferior cerebellar artery, commonly abbreviated as PICA. Then it also gives you medullary branches, meningeal branches, and more importantly for the spinal cord, it gives you the posterior and the anterior spinal arteries. However, Your posterior spinal arteries can also be direct branches of your posterior inferior cerebellar artery. And with reference to the vertebral artery, there's something known as subclavian still syndrome, where if you're going to have a blockage proximal to where the vertebral artery is given off, the vertebral artery will simply steal the blood that is already in the axillary system and redirect it all the way to the brain. Right? Then we also have something known as a cervical rib. A cervical rib is an extra or an accessory rib that connects your cervical vertebra to the first rib, and this can compress structures on your thoracic superior thoracic aperture, which includes the subclavian artery, and you're also then going to have paresthesia that is going to be on the medial aspect of your upper limb because you affect the lower trunks of the brachial plexus. Then you also experience ischemic problems in your upper limb because you affect the subclavian artery as a whole, which we just said is then going to become the axillary artery. Then we can also have something known as dysphagia lusoria, where if these branches are given off from the descending thoracic aorta, they can then actually compress your esophagus and give problems with swallowing and eating. Right. Then also from the first part, we have the artery that we call the internal thoracic artery. The internal thoracic artery arises from the inferior aspect of your subclavian artery, opposite to where we give off the thyrocervical trunk on the upper aspect. And if you remember from your thorax anatomy, the internal thoracic artery will travel a fingerprint lateral to the sternum, and it gives you the anterior intercostal branches for the upper 6 intercostal spaces. And as I alluded to earlier on, it's also known as the internal mammary artery. So it's also then going to give you branches for the mammary gland. And then the 6th intercostal space, it will divide into your musculophrenic artery as well as your superior epigastric artery. The musculophrenic artery will then give you the anterior intercostal arteries for the lower 5 intercostal spaces. Then your superior epigastric artery will then give blood supply to the anterior abdominal wall, and it ends by piercing the rectus sheath, where it will anastomose with your inferior epigastric artery, which will be coming from lower down there, right, from your external iliac. Then you then have the inferior thyroid artery, which is a branch of your thyrocervical trunk. Inferior thyroid artery, more importantly, will give you branches for the thyroid. But if you remember your thorax anatomy as well, if you look at the trachea, its upper 2/3, which is the cervical part, will also get blood supply from the inferior thyroid artery. Then if you look at the upper third of the esophagus, it also gets its blood supply from this very same inferior thyroid artery. And it will also give us pharyngeal branches, and it also gives us an inferior laryngeal artery for the larynx. And that's quite important because it's related to the recurrent laryngeal nerve and can also be damaged during thyroidectomy, right? Then for the gland itself, which is our thyroid gland, your inferior thyroid artery will give you an ascending and a descending branch for the thyroid, and those will actually end by anastomosing with the fellow on the opposite side. Right? Then we have the transverse cervical artery, also a branch of the thyrocervical trunk. This artery will give us a superficial and a deep branch. Right? And if you look at the superficial branch, it's going to anastomose with the superficial branch of the descending branch of the occipital artery, which you're going to see on the external iliac. Right? And the deep branch for this transverse cervical artery will take part in the anastomosis that is around the scapula, that we call the scapular anastomosis. Right? And now looking at the common carotid arteries, the common carotid arteries, like I said earlier on, you're going to have a left common carotid artery that is coming from the arc of the aorta directly. Then we have a right common carotid artery that is being given off from the brachiocephalic artery or brachiocephalic trunk just behind your right sternoclavicular joint. So these are going to be arteries that run from behind your sternoclavicular joint to the upper border of your lamina of the thyroid cartilage, or you can even say directly opposite the disc between C3 and C4, where they're going to then divide into an external carotid artery and an internal carotid artery. But more importantly, for this common carotid artery, it can actually be compressed against the prominent anterior tubercle that is on the transverse process of C6 that we call the carotid tubercle or Chesegnex's tubercle. And we can also feel the pulse of the common carotid arteries, and we can use it to assess the volume steadiness of the blood, and that's one of the most constant pulses in the body. Right? So they then divide around C4 into an external carotid artery and an internal carotid artery. Right? So the external carotid artery is now going to run from this very same upper border of your lamina of the thyroid cartilage, where it's being given off, to behind the neck of the mandible, where it's going to terminate within the substance of your parotid gland by dividing into its two terminal branches. That is going to be the maxillary artery and your superficial temporal artery. And this external carotid artery has a curved course, and it lies anteromedial in the upper part in reference to your internal carotid artery. Then in the lower part it lies anterolateral, right? And in mnemonic to remember the branches of your external carotid artery is some anatomists like freaking out poor medical students, right? And from those arteries, you'd find that three of them, which is superior thyroid, the lingual, and the facial, they're going to be branches that are given off on the anterior aspect of your external carotid artery. Then the occipital and your posterior auricular artery, they're going to be branches given off on the posterior aspect. Then the ascending pharyngeal artery is given off on the medial aspect. Then the maxillary and the superficial temporal, they are the terminal branches. Of these terminal branches, your maxillary artery will be the larger. Then the superficial temporal artery is the smaller, but more direct continuation of this external carotid artery. Right. So to start with, the superior thyroid artery is given off just below the tip of the greater cornu of your hyoid, and from its name, it's going to give you branches to the thyroid gland, which are glandular branches. And if you remember, when we mentioned the inferior thyroid artery, we said it was going to give us the inferior laryngeal artery. So if you then look at the superior thyroid, you expect to find your superior laryngeal artery. You also find cricothyroid branches, stenomastoid branches, as well as an infrahyoid branch, which is given off just where it's given off, just below the tip of your greater cornu of the hyoid. Right. Then you then have the lingual artery, which is the main artery of the tongue. Lingual means tongue, and that lingual artery is going to give you the suprahyoid branch. It also gives you a sublingual branch for the sublingual gland. It also gives you a dorsolingual artery for the tongue. Right? And more importantly, the suprahyoid branch of the lingual and the infrahyoid branch of the superior thyroid will actually anastomose with their fellow on the opposite side, meaning the lingual artery for the right and the left, they anastomose via their suprahyoid. Then your superior thyroid for the right and the left, they anastomose via their infrahyoid branches. Right. Then we have the facial artery, formerly known as external maxillary artery rather, which is a kinked course and is rather tortuous, for the reason simply that the muscles of facial expression would actually tear off the artery due to all the facial expressions that we make. So to avoid that, it has a tortuous course whereby the movements caused by facial expression will allow the artery to now stretch and not tear from its original kinked course. And this artery will give you superior and inferior labial arteries for the lips. Also, it gives you a lateral nasal artery, meaning in a way it's also going to supply your nose. Then you also have submental, tonsillar branches, ascending palatine branches, and muscular branches for the muscles of facial expression within your face. Right. Then we have the occipital artery and the posterior auricular arteries, which are the branches that we're saying they come from the posterior aspect of your external carotid artery. This occipital artery will have the hypoglossal nerve, your cranial nerve number 12, walking around it, which is going to be the nerve for the tongue. And it is a course that is going towards the back, and when it's going towards the back, it actually crosses the apical part of your posterior triangle. which is actually then referred to as the occipital part of your posterior triangle. Remember, you can divide it into an occipital part and a subclavian part, right? Then the occipital artery will give you auricular branches for the cranial part of the ear. Then it also gives you meningeal branches. But more importantly, it gives us a descending branch, which earlier on I said is superficial branch, which is the superficial branch of the descending branch of your occipital artery, will anastomose with the superficial branch of your transverse cervical artery. And the deep branch will then anastomose with the deep cervical branch of your costocervical artery. Remember, the costocervical artery is a branch that is emerging from the second part of your subclavian artery on the right side and the first part on the left side. This costocervical branch, besides giving off the deep cervical artery, which you are concerned with in the head and neck, will also give you a superior intercostal artery for the upper two posterior intercostal spaces. Right. Then your posterior auricular branch will give off branches that are going to the auric of the ear. Auricular branches also gives you stylomastoid branches that we're going to see within the middle ear. Right. Then there's an ascending pharyngeal artery which runs between the side of the pharynx and the internal carotid artery all the way to the base of the skull. Gives us pharyngeal branches, meningeal branches, as well as tympanic branches that we're going to see in the middle ear as well. And these are the two terminal branches. There is superficial temporal and there's the maxillary artery. The superficial temporal artery is also known as the anasthesis artery because its pulse is easily accessible in this region. And earlier on I said it's the smaller but more direct terminal branch of the external carotid system, whereas your maxillary artery is the larger terminal branch. And if you look at the branches from the superficial temporal artery, we expect transverse facial, there is the anterior auricular artery, as well as your middle temporal artery. Right. Then the maxillary artery is divided into three parts by the lower part of the lower head of your lateral pterygoid muscle. And if you look at the first part, it's going to give you 5 branches. The second part gives you 4. The third part will then give you 6. And an easier way to remember, the branches from the second part, they're simply branches going to muscles, mostly muscles of mastication. So you expect deep temporal arteries for the temporalis muscle, you expect pterygoid branches for the lateral and the medial pterygoid. Then you expect your masseteric for the masseter muscle. Then there's also a buccal artery. The first part gives us 2 branches that have meningeal in them. There's the middle meningeal artery and there's the accessory meningeal artery. The middle meningeal artery, you remember that it then gains access to the cranium by passing through your foramina on the base of the skull. And this is the same artery whose anterior division can be injured at the pterion. Right. Then there's an inferior alveolar artery. Then we also have 2 arteries specifically for the ear. There is the deep auricular and the anterior tympanic artery. Then from the third part, we give off the infraorbital artery, which travels with the infraorbital nerve, basically the continuation of your V2 maxillary nerve. Then we also have posterior superior alveolar, the greater palatine, the pharyngeal, the sphenopalatine artery as well, then the artery of the pterygoid canal. But not forgetting that this sphenopalatine artery, the greater palatine artery, as well as 2 arteries that we're going to see from the ophthalmic artery coming from your internal carotid system, which is going to be anterior ethmoidal and posterior ethmoidal, as well as a branch from the facial artery, will form something known as the Kieselbeck's plexus or litus area within your nose. Right. Then lastly, the last branch for the common carotid system is going to be the internal carotid artery. We divide the internal carotid artery into 4 parts. There's going to be the cervical part where we don't really have branches from this internal carotid artery. Then there's going to be the petrous part, which is lying within the petrous part of your temporal bone, where we're going to have caroticotympanic arteries. Remember, the internal carotid artery actually passes on the anterior aspect of the middle ear and gives off a caroticotympanic artery. Then we also have pterygoid arteries. Then we have a cavernous part where we give off branches that are cavernous branches for the cavernous sinus. And you also give off the superior and the inferior hypophyseal arteries that are going to the pituitary gland. Then we have a cerebral part where it of course terminates by giving you two main important arteries for the brain. That is going to be the anterior cerebral, the middle cerebral artery as well. But before terminating, it gives us the anterior choroidal artery for the choroid plexus of your ventricles, as well as other diencephalic structures. Then it also gives you the posterior communicating artery, which takes part in your circle of Willis. Right. So that's just about it. Thank you for watching.